Hey, happy Monday night here. It is freezing in Michigan, especially over here in Grand Rapids. Not the best weather, that's for sure. We had a lot of businesses closed around me. I still made it into work, so hope all of you that had to go into work were driving safe travels, nothing bad happened out there. So just make sure you're taking those extra precautions if you are having to go into work and make any trips. So make sure you're driving safe. But tonight, just wanted to go over with everyone. It is Monday night, so where I do my Facebook Live sessions, you can ask questions. I appreciate all the feedback everyone's been given regarding them. And so if you ever have any topics you want me to cover, don't hesitate to ask. This is a topic that a lot of people have been asking about and dealing with, and that is shoulder pain. A lot of people out there right now dealing with shoulder injuries, especially when it comes to overhead lifting. Hey Steve, hey Anna Marie, thanks for watching. A lot of the individuals that I work with, a lot of overhead athletes, whether it's CrossFit or weightlifting, bodybuilding, baseball, a lot of these people deal with shoulder injuries pretty frequently just due to the nature of the sport. And it's my job to help them get back to doing what they love and correcting what it is that caused that. So there's a number of things out there that can be what's wrong and what is causing the shoulder pain. It doesn't always have to come on with a traumatic onset, meaning you tore something or you fell on it necessarily. Sometimes it just gradually comes on and then it just doesn't seem to go away, and that can be very frustrating and really limit you from what you're doing and what you love to do and staying active. So if you find this beneficial, please give me a thumbs up or a heart if this is sounds like you or someone you know. But the shoulder is a very complex joint. You have your ball and socket joint, so you have your humerus on the glenoid, so it's kind of like this, and you've got your labrum surrounding that, as well as some other ligaments holding that together. And then on top of that, to get the shoulder to move, obviously you have the muscles surrounding it. So the shoulder is actually made up of, just so for your information, the glenohumeral joint as well as the scapulothoracic joint. I know I'm using kind of a lot of big words, but that kind of shows a little bit of the complexity of what is going on and what you need to understand. And it's not just, you got to look at multiple structures there, which can be very confusing. And so one thing that I find with the shoulder joint is we're going to go into a few things. How you're warming up, and if you're warming up appropriately, the mobility of the joint, as well as the stability of the joint. And with any joint, it's got to move. And if it is moving, so if it's not moving enough, hey Diane, thanks for watching. If the shoulder's not moving enough, then you need more mobility there. We need to put some WD-40 on it and get that joint going. And if it's moving too much and doesn't have the stability, the muscles aren't strong enough to hold it, then you need to work on that. And sometimes, it can be a little bit of both as well. So what I find with a lot of my people dealing with shoulder pain is really screening that range of motion, making sure that they're getting that proper mobility. One thing I find is, yes, they can reach up overhead, but where are they getting that motion from? So a lot of people end up getting it from their back because they're so tight through the shoulder. In order to get up overhead enough, they end up arching and trying to compensate there, which can definitely lead to further problems. So that's one thing to look for. How is your mobility? So in regards to mobility, then you really need to, if that's something you're lacking, you really need to make sure you're warming up appropriately before you're going into your exercise routine and regimen, especially, if you're going to be doing a bunch of overhead lifts. And that involves dynamic warm-up. So this is something I've talked about before, but doing a dynamic warm-up is extremely important. So what that means is you're moving through the warm-up. You're not just sitting here and holding for 10 seconds here and then 10 seconds over here. You need to be doing the movement patterns that you're going to be executing in your workout routine and incorporating those into your warm-up. So that can look at, doing lighter weight, using some PVC pipe, really getting everything moving and warmed up, getting that joint going and loosened up appropriately before you're going to get into that lifting. So then, looking at, hey Chris, thanks for watching. Hey Arius, thanks for watching. So then you're looking at, like I talked about before, next, stability and making sure that joint is strong enough to really handle the loads that you're about to put it under. So if you don't have that stability there, you're likely going to be, thanks Arius, glad you like that. If you like that tip, definitely give it a like, thumbs up. So if you don't have the stability in that joint and the muscles surrounding it, there's a lot going on there with especially the parascapular muscles. I find a lot of people have mid-trap weakness and lower trap weakness, and they really, especially with overhead lifts, end up compensating through their upper traps, their deltoids. They're kind of doing one of these numbers where they're shrugging to get that weight up overhead. And that's when you're definitely going to get hurt if you're lifting more than really you should be. So getting that good warm up in, and then really making sure you're safe with your lifts, you're using proper mechanics, and your body can tolerate those loads appropriately. So if you don't know if you can tolerate those loads appropriately, you need to be working with someone who can watch you and knows what they're doing, whether that's a personal trainer, a physical therapist, a coach of some sort. So these are things that I really coach my athletes on and my patients that are looking at doing these type of activities. And again, if you have any questions, anything specific, I know I'm speaking in very general terms right now, but just leave them in the comments below and I'll try to answer them as best I can for you and for your situation, or you can message me as well. So the other thing that we want to make sure we're doing is a proper cool down and stretching. So, once you're done exercising, it's important to get that stretching routine in. And so I talked about that dynamic warm up you want for before the workout. You really want a good cool down. So lighter weight with the cool down, and then stretching for 30 to 60 second holds, those static holds at the end, and reinforcing that mobility to loosen up the muscles. And those muscles are already warmed up from the workout you just did, the exercise. Now you want to stretch them and really work on that muscle flexibility if that's what you're working on, or some of that joint capsular mobility, but especially that muscle flexibility. Those static holds, 30 to 60 second holds after the workout are important. So make sure you leave yourself those 5 to 10 minutes afterwards to really work on them. And that's when you can be doing, leaning through a doorway to stretch out the pecs. I find that pecs are tight in a lot of people with shoulder issues. Lats, doing like a child's pose, that can be really beneficial. Those are just a couple. There's a ton of different ones out there, and utilizing those and finding where you're lacking and really getting into your impairments to make yourself a better athlete, help you move better, move more efficiently, is going to be what's key for you. So if you're curious, I recommend going to your local physical therapist and asking them for advice if this is something that you really think that you need help with. So that way they can look into your specific needs, because everyone's a little different. No two shoulder injuries should be treated the same, because everyone moves differently. So just because something worked for Joe, doesn't mean it's going to work for you. That's what I make sure I tell everyone, even when it comes to whether it's surgery or conservative methods, whatever it may be. Everyone's different. Everyone moves different. How you move is going to be different than how the other person. Dad, what is a child's pose? That's a great question. So that is where you are on your knees, you rock back, you're trying to touch your butt to your heels, and your arms are up overhead on the ground, really getting a stretch through the lats there. You can find that actually, I believe I have it posted on my YouTube channel. If I will post it onto here, so I'll post in the comments so that way you can see that. So again, the main things to look for with shoulder issues: 1, your mobility; 2, your stability, and how are you functioning under the load that you're putting yourself under. And then, the other parts are the dynamic warm up and the cool down and stretching. So make sure that you are doing all of those things. They're all important. And if you have any questions, don't hesitate to put them in the comments below. I'd be happy to answer those for you. Mary, glad you like that. Thanks for watching. I really appreciate it. So I'm glad you found this beneficial. If you found it beneficial, please give me a thumbs up. Really loves the support. So some things that I'm really doing too, rolling out with, I'm really adding to my YouTube page right now. So I'm going to be adding a bunch of shoulder videos to my YouTube page. So follow Fuel Physical Therapy and Sports Performance on YouTube. I will post a link in the comments below, and you can go there, follow it, and watch some of the videos on some of the exercises that I talked about. And I'm going to be constantly adding new things to that all the time. So be sure to follow that and check it out. Don't hesitate to message me if you have any specific questions. And I appreciate you guys all tuning in tonight. Have a safe rest of your week. Weather's supposed to be absolutely terrible tomorrow and Wednesday as well. It's going to be bitter cold, so make sure you're dressing warm. Don't head out into your car without any hats, gloves, because from the sounds of it, you're going to get frostbite in a few minutes, especially on Wednesday, if you do get stuck outside. So dress warm, be safe, and I will see you next time. In the meantime, don't hesitate to message me if you have anything you want me to make a video on. I'm always looking for new ideas and want to listen to you and what you want to hear about. So thanks so much for watching. Have a great night.